Measles cases are sparking concern nationwide, yet West Virginia remains free of confirmed cases so far, a success credited to strong vaccination rates. Newswatch reporters Caleb Pearl and Danny Delante have that story.
Measles is staging a troubling comeback across the United States in 2025 with over 300 cases and 2 deaths so far, topping last year's total. Outbreaks tied to low vaccination rates are hitting states like Texas hard, but West Virginia's 98.3% measles, mumps, and rubella rate for kids is keeping it at bay. At New River Health in Oak Hill, Chief Medical Officer Angela Barker says that success is no reason to let our guard down.
We will get exposed. Thankfully, right now our immunization rates are pretty high in West Virginia, so most of our population's protected, but there are those anti-vaxxers and people who just don't believe in vaccines, so we will have, hopefully not an outbreak, but we will have cases here.
Barker's worried about a rising tide of vaccine hesitancy creeping into West Virginia, even with its strong track record. She says misinformation is chipping away at trust in a tool that she says is a public health cornerstone.
People that don't want to get their kids vaccinated. There was some bad press about autism, but vaccines are the single best public health measure that we've instituted in this country, and they're highly effective and safe. So,
measles doesn't mess around. It's a highly contagious virus that can spread through the air with ease. Barker says it starts subtly, but the symptoms soon make themselves known.
The symptoms are a lot like cold: runny nose, fatigue, cough. And then about 5 days post-exposure, you'll get the measles rash. And then they're contagious for about 4 or 5 more days after that.
And for adults who might not know if they're protected, Barker says there's no need to guess. There are practical steps to stay safe, especially for those working on the front lines.
You can get a booster as an adult. It's actually recommended probably for healthcare workers. But you can also get your levels checked with a titer. It's just a simple blood test, and it can tell you if you're immune or not.
West Virginia's place among the nation's leaders in vaccination rates has kept the measles at bay so far in 2025, but change is looming. Once a leader with some of the strictest childhood vaccination laws, the state could soon see religious and philosophical exemptions under a proposed 2025 law, still pending approval in the House of Delegates despite medical pushback. Reporting in Oak Hill with Danny Delante, I'm Caleb Pearl for Newswatch.